Hello, I'm Donal McCauley from BJGP. Today I'm talking to Iona Heath, a very experienced general practitioner, past president of the college, and a deep thinker about all things relating to primary care general practice.
It's how everything has gone completely crazy, and I've always had a particular concern about how we handle death in the 20th and 21st century. And we have suddenly seem to have gone right back to death being a technical issue, really. I think we're going to reap the whirlwind after this epidemic in all sorts of dimensions of culture and society. But I think if we continue to stop people being with their dying relatives, then there's going to be a mental health thing to pay. You know, lots of people don't get over losing their parents anyway, or losing children, or and if they can't even be there to say goodbye and hold their hand. And it seems to me it cannot be beyond the wit of man to sort out a process whereby people can sit with their dying relatives and hold their hands. And okay, they could wear some protective equipment, but I think they then need to self-isolate. I think people should be able, you know, the patient's supposed to have choice in these situations, and I would have thought relatives could decide for themselves whether they wanted to take the risk, whether it was more important for them to be with their relative. And then they would obviously have to come out from the hospital and self-isolate. But to just have a blanket exclusion on not being able to be with somebody, to hold their hand, to talk to them, to say those crucial last things that you need to say to people when they're dying. We're turning it all into the sort of traumatic bereavements that you get after an earthquake or a bombing or something where there was no chance to say goodbye. But often these deaths are protracted. And so you know that there's a space where this could be happening. And people are trying to do it with iPads and all this sort of thing. And it's just not the same. This is not the same conversation I'm having with you that we would have if we were both able to sit together in the college, because there's something about human contact that goes beyond a two-dimensional image. So I think that that's very, very important. I'm worried about how we're handling dying. And most vulnerable older people, I would assert, do not wish to die in intensive care on a ventilator. And they would not wish to take a ventilator away from a younger person who was more likely to benefit. So why go into hospital at all? Why don't we have a system of being able to support older people in the home, you know, up to the point of oxygen, but not beyond? Because intubation is a great risk to the health workers as well. You know, it's all snot and coughing, and I mean, it's the most contagious sort of event. And I don't think many older people would want to do that to healthcare workers who are in this very stressed situation. And it's this idea of we all will die, we all have to die. In occasions like this, suddenly nobody must die. Some of the deaths that are happening are extremely timely. Some are not, some are very tragic, but some are quite timely and evoke the old adage of pneumonia being the old man's friend. It's not the worst way to go when you're very old. And the related issue that's really upsetting me at the moment is the outcry about people having do not resuscitate things when they're living in a care home. Of course you shouldn't resuscitate anybody living in a care home, because it's a useless activity. It doesn't work. If you're over 80, your chances of surviving and returning to a normal life after resuscitation is practically zero. So why are we being so childish about it and saying that it's like the Americans saying that the NHS is, you know, it's a death sentence, and It's nothing to do with that. It's about dignity in dying and about respecting what old age is about and what, am I making any sense at all?
So one of the aspects of the COVID-19 is whether or not patients will access healthcare for fear of being admitted to hospital away from their families.
Yes, I think we haven't begun to count the cost of the level of fear that is present in society at the moment. And I strongly suspect that there may be more additional deaths because people are not seeking help. And because the doctor's mental landscape narrows, the patient is frightened to consult. And then when they go anywhere near a hospital, then they get all this terrible distancing and only see people in protective equipment if they've got it, of course. So I think I think there's going to be a legacy of very traumatic bereavements, where people have not had time to process, they've not had time to say goodbye. And touch, I think touch, I've written about this, I think touch is so important in dying, because touch is a way of continuing to communicate even when the other person is unconscious. We're stopping love being in the equation. We're saying risk of infection is more important than human love in this context. That cannot be right. Nothing is more important than love.